Okay, guys, so this is medical terminology, and we are going to be going over chapter 2 in the medical terminology systems textbook. So I am going to pull that up and we'll go through that. And please hold your questions for the end, and I will be happy to answer them. Okay. There we go. Okay. So what's a suffix? A suffix is a word element that's placed at the end of a word. It can change the meaning of a medical word. So it can be used to denote whether it's a singular or plural form of a word, or it can be used to denote a part of speech. Major types of suffixes are either surgical, like ostomy, otomy, ectomy, right? Diagnostic, pathological, and so on. So diagnostic, tests, pathological things that are wrong, grammatical and diminutive, or singular and plural. And we'll go over some examples. So a type of invasive procedure performed on a body part, like an appendectomy. So ectomy, removal of, append is appendix, removal of the appendix. Arthrocentesis, centesis is sticking a needle in to draw out fluid. Arthro, meaning of the joint, right? Lithotripsy, we're talking about going in to break down or pulverize, like with renal calculi, for example. So a word root links a suffix that begins with a vowel. So in other words, like gastra, gastritis. So the combining form links a suffix that begins with a consonant. That's really the only difference, is the word root, the suffix starts with a vowel. The combining form, the suffix starts with a consonant. So, and the combining form example here is gastroscopy, because it'd be really hard to say gastroscopy without that O there, right? Okay, so surgical suffixes, excision or removal. Excision or removal would be ectomy, right? Surgical puncture, centesis, crushing, tripsy. So we'll go over some of these later on, so you can actually use the words. Okay, so this is an exercise that I'd like for us to do together at the end of the chapter. Okay. Diagnostic suffixes. So these are suffixes that talk about a procedure or a test. So we're trying to figure out what's wrong with the patient, and we're testing to try to give us more information. And so examples would be electrocardiogram. So that's got a lot of parts to it, but it's electric, and the gram part is where we attach electrodes to look at the electrical activity of the heart. Gastroscopy, whenever you see scopy at the end, that means that we have a scope, which is basically a catheter or a tube with a camera, and we're going in to look at something. In this case, the stomach, we're going into the stomach, but it can be a bronchoscopy, et cetera, et cetera. Encephalography. So, and encephalo meaning the brain, and ography or graphy meaning, to look at, like diagnostically, MR, CT. We're going to cut through these. We'll talk about pathological suffixes, right? So the others were diagnostic. These are the pathological. Pathos is from the Latin, meaning, something's wrong or bad. So when we talk about pathological, that means that something is wrong, person's sick. So an abnormal condition or a disease. Examples here: neuralgia, nor meaning of the nervous system, algia is pain, gastritis, itis, inflammation of gastrostomach, hemorrhage, and the RRHAGE, Raj at the end, is, bleeding or a flow of fluids is the actual definition of that, like diarrhea, okay? Okay, then we have grammatical and diminutive suffixes. So these are suffixes that get attached to the word roots to form a part of a speech, like an adjective or a noun. So when we're saying, something, related to the stomach, gastric, that IC is the suffix. Neural, something related to the nervous system. And obstetrician is someone who practices obstetrics, right? And then pneumonia of the lung, and that's, pertaining to inflammation of the lung, okay? And then the diminutive, meaning smaller, right? It's a smaller version of the word. So tubule is a minute, like a little tiny tube. Arteriole is an itty bitty teeny tiny artery. Okay, so when you see that OLE at the end, tiny. Okay, so here we have an outline, right? The adjective suffixes, which are AC, AL, AR, ARY, IC, ILE, and OUS. So we'll go through these so that you understand what they all mean. And I'm going to ask you guys to actually get a little notebook out or a piece of paper, whatever works for you. And on the break, I'd like you to try to go through these little exercises and then we'll go over them. Okay. Okay, singular and plural suffixes. So they change when a word is being modified to go from a singular to a plural form. So diagnosis is one, changes to diagnoses, multiple diagnoses. Bronchus, the plural is bronchi. Deformity, deformities, right, with the IES. And I like these exercises, so this will be helpful to go through. And I think that that is the end of that slideshow. So let me stop the recording for a minute.